Yeah, the ultimate webinar before the Christmas break. So I'm hoping that everybody's staying really, really strong. Not much longer now. The end's in sort of our sight. And what fantastic news we're going to be celebrating today with the sort of vaccine on the horizon. So some really, really great sort of things to sort of celebrate about, but that's not to minimize the hard work that lies ahead, both in terms of just getting through the whole vaccination process so that we're going to be properly protected, but then it's all going to be about developing our vulnerability vaccine, the vaccine that's going to protect our children, young people, and our school leaders and our school sort of staff over the forthcoming years as we try and desperately mitigate the problems that will play out for a long, long time that have been created over this last year. So welcome to everybody to the webinar. As always, it's a great privilege to be hosting this fantastic event. It really is such a great celebration of everything that's good about Bradford, the whole community coming together for the benefit of children and young people. So we are going to start today by hearing about the latest news with regards to the vaccines from Dinesh. Then we're going to be hearing the latest news from our public health colleagues. Then really excited to be hearing from Ruth Dennis, who's the head of the educational psychology sort of services, before then hearing from all of our heads. The highlight of today is going to be the launch of the Swoosh, our school staff wellbeing support sort of her service. So really impressed beyond words at the fantastic community that have come together in order to get this up and running. Really so important to be providing the best possible support we can to school leaders and staff during these difficult sort of times. So Katie, can I just check whether we've got Dinesh online?
Yes, we have.
Fantastic. Right. So Dinesh, can I hand over to you and can you lead us in our celebration of all good things vaccine related?
Thank you. Thank you, Mark, and hello to everyone. Yes, we heard the good news that Pfizer was deployed this week. So just to give you a brief insight, there are close to about now 40 candidates in advanced stages of vaccine trials across the world. So in this country alone, there are at least 6 candidates in phase 3. So the Pfizer is partnered with a biotechnological company, and they were initially going to come to the UK as early as July. So they are far ahead of the game. So they did their phase 1 and phase 2 between May and June, and then went to their phase 3 in July. Not surprisingly, they've got their data well in advance of the other candidates. The Pfizer is a slightly complex sort of vaccine in that it requires a very stringent cold chain. And the reason why it's going to be a tough vaccine to deploy, and I think I wouldn't get many of your people on the call too excited about Pfizer, is that it has got a cold chain that has to be maintained at minus 70 degrees. And just to let you know, there are not many hospitals across the region who have a minus 70 freezer, let alone number of fridges. So the other thing to consider with Pfizer is that it is a US-based company and the FDA are that close. The Pfizer vaccine was published in the New England Journal today, and the phase 3 results, the early phase 3 interim analysis. So they're going to get FDA approval in the US, and probably the UK before Christmas will probably, or maybe into the new year, will get only about 800,000 doses to start off, in contrary to the 40 million doses that they've already purchased. So it's going to be slow. In terms of how they will be deployed, the medicines health regulatory agencies, the MHRA, has allowed only four moves for the vaccine. So what are these 4 moves? From the factory in Brussels or Belgium to the airport, and from the airport to London, that will take 2 moves, from London to the hub, and the hub to the vaccination site. So it cannot move directly beyond the vaccination site to the care homes, but there is a way that they could, if they come in boxes of 975 doses, which have to be taken out from a freezer, thawed, and then the thawing process takes between 4 to 6 hours, and then it has to be deployed within 120 hours. Those 975 doses need to be done, vaccinated within 120 hours, that is roughly about 5 days. Now, So the deployment of this vaccine is going to be slow, partly because the supplier is not got so many ability to produce. It's quite a vaccine which is quite tough to produce quickly. So the Pfizer vaccine is probably going to go to our 80-year-olds, people in the healthcare sector who look after these vulnerable 80-year-olds. And for those people who visit hospital for an outpatient appointment, today I've been involved with the task of calling some of our rich, diverse community in Bradford to see whether you would have the vaccine. Now, if you take the South Asian population, one of the challenges is we don't see many 80-year-olds in the South Asian population because, the average life expectancy is much lower. And then the logistic challenge of bringing these 80-year-olds to the hospital, because as I've told you, they can't be allowed a fifth move. So they have to come to a hub to have the vaccine. So it needs to be people who are relatively in better health than others. But as the vaccine rolls out, it will be rolled out in a much more phased manner into the care homes. We are very close to getting the approvals for the Oxford vaccine. The Oxford vaccine is a much more easier to store vaccine. It's much more likely to be deployed across the general public in this country. Probably Oxford will be deployed in the new year, going into spring. And then comes the vital vaccine that we talk about, the one that we've been involved in Bradford called Novavax. So Novavax is the largest phase 3 efficacy vaccine trial which has taken place in the UK, having recruited 15,203 participants. We used a single dose, a lower dose strength of the vaccine in the UK, but there are some concurrent phase 3 trials going on in Mexico with 15,000 individuals and the USA 15,000 individuals. So Novavax is where we would put our money on. One vaccinologist expert, I don't call myself as an expert, but I can claim expertise in running a trial, claims that the Novavax will come as a winner when compared to all other vaccines and will probably be the vaccine that will roll out to the general public. And just to give you an idea where the government thinking is on the vaccine is, the government has purchased 40 million doses of Pfizer. So if you divide it by 2, it will vaccinate 20 million of our population. There will be some vaccine wastage because of the stringent storage facility. Then there's a company called Moderna, which they have purchased about 20 million doses. You divide that by 2, that gives you another 10 million. And then the big player, Novavax, they have purchased 60 million doses. Divide by 2, 30 million. And then we've got unlimited resource from the Oxford. So if you ask me, if I'm a punter, I will probably say between Novavax and Oxford will cover the vast majority of our population. So for us as a group here, that includes me, I've been told that even though I look after COVID patients, I'm not a priority for Pfizer, which some people may find a bit perplexing. But it is going to go to people who actually look after those vulnerable 80-year-olds. I could argue that I look after some of the sick 80-year-olds. But it is going to roll out predominantly to people who have pre-existing health problems, who are at the highest risk of getting COVID-19 in the next month. So we want to prevent death in those patients. Of course, they'll have 2 doses, 21 days apart. And all vaccines, we think, and it's very important, the good news Mark mentioned for the new year, we think coronavirus is a highly vaccine responsive virus. It will respond to a vaccine. And I think all candidates, unlike normal phase 3s, we think only 30% of vaccines will make it through phase 3. I think here the finger is going to be much higher. But the crucial question is, how long will this immunity last? That we don't know, because Pfizer has produced 95%. So I have to make sure what the headlines translate in layman's language. 95% efficacy means that in 95% of the people who got the real dose of the vaccine, you did not get serious or moderately severe infection, which was the primary endpoint of the trial. So we can still get asymptomatic, but it's still going to prevent death, which is the crucial thing. So in 5% of our population, we will still get some disease. So there will be some disease floating around. There will be no vaccine which will give us 100% efficacy. So you may argue that we may have to overlap and have one more vaccine to give us that overlapping 100%. So only time will tell how the strategy plays out and how these vaccines behave in 6 months' time. So Pfizer's interim analysis was 6 months long. So when they do a 9-month interim analysis, we'll see whether the antibody responds. So they will have a subset of their people, as with our trial, continuing to stay in the trial and having antibody responses monitored. Then come the other players. The other players are, there is a study underway in phase 3 called the Janssen study, Johnson & Johnson, and then the next one, Sanofi, which is the typical pasture to sort of vaccine, inactivated virus, COVID virus. It's taken a long to produce. And luckily, Bradford will be taking part in that trial, but these numbers recruited will be globally about 120,000 subjects with a UK recruitment target of only about 1,200, maybe more than that, maybe 2,000. And we've been asked to recruit only 200 subjects into that trial. That trial will roll out towards the end of March and will provide, in my opinion, another good vaccine in the spring or early summer. So let's keep our fingers crossed. If all these candidates work and the government gets the act of vaccination, as Mark mentioned, across the sector, it's hard to predict how the priorities are going to pan out. I think it will probably pan out the way that they describe 80-year-olds, then healthcare sector, frontline health workers, and then frontline staff who are not involved in the health sector, then roll out to the general population, and finally coming to your sector, the schools. I think my own opinion would be, this is only my opinion, I think must take priority for the teachers before it rolls out to the students. So let's keep our fingers crossed. I think these are the order. You'll have Pfizer, you will have Oxford in the next few days, then we will have Moderna, and then we'll have the big vaccine, as I always label, Novavax, which has got so much of promise, and we hope that it will be a success story. We can say that Bradford took part in that little piece of history.
Fantastic. Thanks so much, Dinesh, and thanks so much for the brilliant work that you are doing in making sure that we are trailblazing in this area. So can we open the floor to any sort of questions for Dinesh? Dinesh, there are a couple of questions right now in the chat. So the first question is, what's the difference between somebody returning from abroad and paying for a test after 5 days and someone getting a test after isolating for 5 days? So that's the first question from Richard Ballantyne in the chat.
It's probably the same, really. If you're paying for a test for 5 days and saying negative, and then isolating for 5 days and having a test, I would go for the former. If you're coming from abroad and if you think that you may be a carrier for COVID, it's better to pay for a test and get a test done. Then you got it out of the way, because the idea of the 5 days is that this is the sequence of COVID. You get the primary exposure to the infection in -3 days, -3 to 0, and then it's between your 0 to 5 days that you exhibit symptoms, you see. So if you are very anxious, it depends on the sort of personality, whether you want to sit and wait, but till you get the first symptom, or you don't have a symptom, and then you're safe to go back if you have a negative test at 5 days. I would say both ways are perfect, but I think if you want a valid test, more specific and a more sensitive test, it's better to do it at 5 days.
Brilliant. Thank you, Dinesh. So next question, which is also from Richard, is in terms of catching COVID for a second time. So they're having examples where staff are going for further tests, having previously tested positive. Also hearing examples of people getting medical advice to take a second test after previously testing positive. Which seems to be counter to what was previously announced, that once you've had it, you won't get it again. Also questions about whether there's a second strain of COVID, which might be causing positive tests.
So Mark, and thank you for whoever's asked that, Richard. So I think COVID-19, the natural antibody response starts about 4 weeks after the primary infection, and it's anybody's guess on how long it lasts. The immune response is measured by an IgG response to COVID-19 rather than an IgM response. And we see a lot of patients who don't mount an adequate IgG response. We have seen in our own case several people getting reinfected after 4 months after the primary infection. So we think that the natural body response, and this is why I said, the real test of a vaccine is whether it can actually produce a long-lasting immune response in our body once you're vaccinated. Nobody knows. I've asked several people this question, do we really need, do you think we need a booster in a year's time? The answer, nobody knows. Only time will tell. Perhaps in June time, we will know, I think, in my own estimate, because the first phase 3 results would have completed, the trials would have completed 12 months around June. Certainly our trial would have completed 9 months in June. So I think we're pretty confident that by June, we'll know whether there is thing. Most of the trials, what happens is, you have a placebo arm and 2 or 3 doses of the vaccine. And what is happening is you're getting an antibody response very initially. Whereas with COVID, it's a very gradual increase. Whereas with the vaccine, the immune response seems to be almost instantaneous after the first dose. So we think that the virus is very vaccine responsive. The antibody response produced by the vaccines are pretty effective in the short term. Whether they last long term is only time will tell.
Thanks, Dinesh. And so I guess, yeah, err on the side of safety is the general rule of thumb here. A really interesting question actually from Joanne here, which is, right, somebody's been vaccinated. Can they now go, fantastic, I'm all right, and just carry on life as normal? What should be the response after somebody's been vaccinated?
So this is an interesting question. And I've asked myself that question. So it depends. So Joanne, what life returning back to normal would mean that 70% of our population, at least 70, that's the threshold. So this is where I'm going to quote some world figures. Worldwide, our population is about 7.3, 7.4 billion. We think the threshold for us to come out of this pandemic is at about 5.2, 5.3 billion. This is what the WHO quotes. So if you have an vaccine-related immune response induced in about 5.4 billion, then our normal life will be comparable to what we led in 2019. So you can imagine the logistics of vaccinating 5.4. So the exit out of COVID-19 is going to be slow. It's going to be painful. It will be there for some time. Social distancing, the measures. So people, anybody in this audience who are in business won't like what I'm saying. This is going to be the norm probably till about July, August time, and maybe even beyond. Because I think the vaccine production occurs in three main countries. Certainly, I'm from India, and India is one of the top 3 producers of vaccines across the world. And they will rely on those developing countries to produce the large amounts of vaccine we need to vaccinate. Remember, we need to be vaccinating Africa. We need to vaccinate South America for us to travel normally. Because coming back to your question, if I have a vaccine and I've developed a vaccine immune response, it doesn't prevent, apart from the Oxford vaccine, which is shown, it does not prevent asymptomatic carrier state. No vaccine has shown that as yet. So I can still get an asymptomatic virus and be transmitting it to others. So even though I'm protected from the virus, I could still harbor the virus and spread it to people who are non-vaccinated or don't have an immune response. For that reason, we will still have to carry on for the rest of the public around us, the same precautions that we are currently taking. Not for ourselves, but to prevent us being a carrier to others.
Dinesh, thank you so much for that. Such wise sort of words. So such great optimism. We can see a way out of it. There is an exit, which is such a reason for celebration. But we ain't there yet. There's still a long, hard road that we've got to travel. At least we know at the end of it that we can get out of this, but we really need to sort of settle in for the long haul here. And I guess everybody within the school system knows that. So Jan just put, so thanks so much for that sort of a clarification. As I say, I think it just sets the tone right. We can't be too optimistic, but optimism should be there. But we can't forget that there's hard work ahead of us. Dinesh, we've just got lots of thank you notes that are coming in. Yeah, just thank you to you and everybody here in the Royal Infirmary for the fantastic work that's sort of happening. John's upstairs sulking because the group really wanted to hear from you and the sort of vaccines, but John does send his sort of good wishes to everybody. Thank you, Dinesh. Really appreciate that. It's really just inspiring sort of stuff. Great to see the health service do their work, but as we like to say here in the hospital, look at all the incredible work that's happening in the schools as well. It's everybody across the whole sort of system working that's going to get us out of this terrible situation. Thank you, Dinesh.
Thank you.
A great Christmas. So what we're now going to do is move on to the next item on the agenda, which is to hear from our fantastic public health colleagues. So Duncan, can I ask you and Georges to give us an update on where we're at, what we need to do from your perspective. So over to you, Duncan.
So I was saying that I think it's just me today. Georges is looking after his little one who's been had to self-isolate from his nursery. So he's fairly busy on that, and they'll be preparing for a trip back to Brazil as well, I think, over Christmas, fingers crossed. So I'll update you on a few things today. I've got some positive messages and then also some notes of caution along the similar veins to hearing Dinesh's good news about the vaccine as well. I want to go over the reporting mechanism over Christmas and New Year as well, because I know you've all had the DFE guidance on that as well, and I'll just update you on what's been happening across schools as well. So just to give you, first of all, a picture about infection rates across Bradford, I think it's useful to update everybody on this. So the overall infection rates have continued to fall. We've had about a 60% decrease in COVID infection rates across Bradford since the start of the second lockdown in November, which is good news. So that's been a huge fall. And we're now below the rate of some of those second tier boroughs. So it's still falling across the north. It's falling quicker in Bradford, and it's starting to go up in southeastern London now. So fingers crossed, we hope that trend will continue. Importantly, hospital admissions and the numbers of admissions per day now are about 5 into Bradford Royal Infirmary and 3 per day into Airedale. So that's starting to drop as well. And then the last indicator to turn is always mortality and deaths from COVID, because there's about a 4 to 12 week gap between infection and mortality. And this week has been the first week as well where we've seen the death rate from COVID start to drop across Bradford district. There's still some pockets and there's some slightly worrying trends around deaths from the BAME population as well. But overall, death rates have started to fall across Bradford now, which is good news as well. So the areas, just to let you know that for me, it's been a little bit like as the tide rises and falls, you've got rocks below the high tide line that seem to be the continual areas of high infection. And as the tide's gone out again and infection rates have fallen, unfortunately, it's those same wards that are the highest rates across Bradford district. So we've still got in the middle of Bradford that big area that covers Toller, Heaton, Bradford Moor, Great Horton, City, Roydon, Wibsey. There's still relatively high rates there, and then Central Keighley as well. So those are still the areas that the rates have fallen in those areas, but they're still the highest ones across Bradford. But in terms of schools and infection rates in children and younger children, been a really big sharp drop off this week in preschool, so nursery school age, and that's really gone down very quickly. I'm not quite sure why that is, but that seems to be falling a lot faster than primary and secondary age. So there's still about double the rate in secondary school children compared to primary school children, and in those school age children, infection rate is falling, but it's slightly slower. The other thing is that the percentage of those overall cases that are in teachers and teaching staff and school staff has dropped as well. So I don't know if you remember, but at the start of this school term, we were getting about half our cases in school staff and half in children. There seems to be a smaller percentage now. About a quarter of the cases that you're reporting through to us in the council are in staff now. So that's really dropped as well, which is good news in terms of reducing risk levels as a profession as well. I think that's really positive. So that obviously the social distancing within schools is working there as well. So that's good news. We've lowered our threshold to support schools, and we're asking you all now to say on the web form to the council whether you want us to phone you back. So that's increased the numbers of schools where we think we've got in-school transmission, and we've got about 30 schools at the moment that we're actively dealing with and supporting, either via Martin, who's joined the education team, who's an ex-head teacher that some of you might have spoken to. George and Femi are still working hard, and the team are still trying to support all schools. So there's about 30 schools that we're working with at the moment. And there is a lot of optimism. It was really good to hear Dinesh talk about vaccine development as well, and the fact that it's going to be starting in Bradford. The words of warning for me, and I think we need to look at the fact that we're coming out of a second wave of COVID, but respiratory viruses, they like winters, they like cold weather, they like it when people crowd together and cough on each other. So we're not out of the woods yet, unfortunately. We've still got January, February, there's going to be some cold weather, and we've still got this 5-day relaxation over Christmas where 3 families can group together and form a Christmas bubble. I'm in a politically restricted post, so I won't say what I think about that, but I'll leave it up to you to guess. So there is a danger that we'll have an increase in infections again in January that's seeded by that Christmas 5-day window. So we need to be really careful on that. And obviously any advice that you can give through to your parents and any of your communications and so on about that, and about observing social distancing during that 5-day period and sticking to your Christmas bubbles, will be really helpful and appreciated. And the other thing about respiratory pandemics is that we need to take some lessons from history as well. And there was a really useful research paper that I read that looked at the history, 100-year history of respiratory pandemics, covering SARS, coronavirus, influenza, going right back to the 19th century. And every single time that we've had a respiratory pandemic that started during spring, there's been 2 or 3 waves over a period of about 12 months. So that's why I think we just need to be wary of that the fact that a 3rd wave next year isn't out of the question, and we need to guard against that and try and flatten that as much as possible if it does start to come back, via all the social distancing and all the measures that you're putting in place with schools that are making a difference. So that was just a bit of a lesson from history as well, that we're not quite over that yet. So I'm going to send out a message as I usually do, with just some clarification about isolation periods, when they start, what your 1 to 10 or 1 to 14 days are, and so on. So look out of the email for that. And then the other thing that we'll do this week as well is I've put a sample letter on Bradford schools online, because the thing that we're continually hearing back from head teachers as well is that some of you are tearing your hair out a bit, that it doesn't matter what you say, parents are still sending COVID positive children in, and contacts in of household positives. So we've drafted a letter about parental responsibility, and we've put in the links to the financial support, mental health and support. I know it's not perfect, and some parents aren't going to be able to get financial support, but I think we have to try everything we can. So we've drafted that letter, and that'll be for use of you if you want to clarify why it is that we're asking parents to make this self-isolation and break those chains of transmission. So that'll be on Bradford School online from tonight as well. So a couple of things just to finish with. The first one is around the DfE guidance that I saw, that's asked you to keep the schools not open, but to keep a line of communication between parents positive and reporting positive cases for 6 days after the end of term. I know that they've said to take an extra day. I can't remember, what is it? It's an inset day, isn't it? So they're saying take an inset day on Thursday the 9th, on the 17th. And then 6 days takes you up to the 23rd of December, and they're asking you to report cases through to the council and identify bubbles that might be contacts, teachers might be contacts, and get in touch with them. So I sort of expected this. I knew it was coming, and I did read it with a really heavy heart, because I know that you just need to go home, have a break. It's been a really, really tough year and a tough term. There'll be a letter going out, if it hasn't come to you already, from Marion Patt's team, the education team, about advice for that. And what we're advising is that you just keep some line of communication open via a phone number for a few hours a day, or via an email, and pass that information on to the contact centre. Council contact centre will be open right up till Christmas Eve, and it'll be opening up again between Christmas and New Year. The public health team will be in right up to Christmas Eve as well. So if you do need a bit of advice, public health advice, just say that you need that on the web form to the council, and we'll get in touch with you again. But remember the 48-hour rule. So if children or teachers haven't been in school, if they've developed symptoms but they haven't been in school for 48 hours, you don't need to report that through. That will be taken care of by a national test and trace system. So after you get, if you're closing school on Thursday, by the time that you get to Sunday, if you've got people developing symptoms on a Sunday, or getting a positive test result on a Sunday, you don't need to report that through, because that'll be 48 hours after they've been in school. So it's really only probably that Friday and maybe a couple of cases on Monday that you might need to phone through. But I realise that's difficult, and that is putting an extra pressure on when you do want to close the schools. So the only final thing I'll say, and this is thinking forward to 2021, is a lot of you signed up for the Bradford Schools Lifestyle Survey. I think we had about 150 schools signed up in March, and then COVID hit, which is a real shame. And we only do this survey once every 3 years. It's free to schools. It's a one-off questionnaire for years 5, 7, and 10, and it will record all sorts of information about lifestyle, about oral health, about physical activity, all sorts of things. You'll get your own school report back that'll be anonymised. We don't see the data about individual kids. It just helps us plan commission services and plan our public health approach across the whole of Bradford. So you'll get your own report. You can use that for your PHSE, you can use that for Ofsted, and also it'll enable us to follow that up with the Healthy Schools programme in 2021 as well, in terms of supporting physical activity and so on, and reduction and other evidence-based interventions that we work with Mark and other people on as well. So please, if you have one action this week, I'll put it in the email I'm going to send to you all. If you could just drop Linda Sands an email back to say, yeah, we want to be part of that, and then we'll do everything else and we'll support you with that. And that would be great. But we do recognise that with the disruption that you get from bubbles suddenly being excluded, it's going to be hard. But I think we have to do what we can, and that data is really, really valuable, and it will be valuable for us when we come out of COVID. So that's it. The only thing that I'll say is, I think that the work that you've done, and I know I say this every time, it is making a really big impact. So over the course of the whole term, our absentee rate for young people in Bradford has been about 10%. So I know some schools will have been impacted more than others, but the work that you've done in schools is ensuring that 90% of our pupils are getting their educational and social development that they need. That is so important. That's made a huge impact. And if you think about the amount of social distancing that a lot of societies had during this term compared to what it's been like in schools, some of which are quite crowded, and the fact that we've still managed to get 90% of our kids in getting some sort of education, that is a huge effort, and that is really, really important for the future children in Bradford. So when I read in the papers that a lot of head teachers and teachers are thinking of quitting the profession, all I can say is we really, really need you. You're making a huge difference. Please think again. It will get easier. It'll go from being really, really hard back to just hard again. And we need you to stay in the profession. We're at the beginning of the end game now with the vaccine, so stick with us. And thank you again for all the work that you're doing for Bradford.
Well said, Duncan. Thank you so much. I've got a few questions for you here, Duncan. So one is whether there's any guidance on heads' role as leaders if they know staff have not adhered to bubbles.
We go down this route quite a lot, and I've trying to find. I mean, you can be fined up to £3,000. That's the bottom line, and heads have to make their own decision about what they do if they get that sort of information. What we try, because we get a lot of reports through the public as well. You can imagine I get all sorts of things sent to me, photos that have been taken on kids' phones and schools about crowded corridors and what you're going to do about this and all the rest of it. Some of it's hearsay and some of it's quite malicious as well. I think if you've got evidence, my advice would be, if you've got evidence about not adhering to bubbles, is that's a school matter. Unfortunately, we haven't got a process with the police or with the council for following individual breaches. So I think you just need to deal that. And if it's a repeated breach, or if you think it's really, really serious and you feel that like the quiet word or the stern word isn't working, there are phone numbers and ways that you can report that through to the police online. And there's phone number, if you just Google that, you'll find numbers online that you can report that through to the police. So that would be my advice, to deal it as an internal matter to start with, though.
Thanks, Duncan. There's a request that you put the link for the paper you mentioned about the history of respiratory pandemics, maybe in this link, or Katie can sort of send that round afterwards. Other question is whether you can provide some clear guidance about the school's response if somebody's in self-isolation and thinks they can come out after a negative test after 5 days.
If somebody is in isolation because they're positive, this is presumably if you're a contact. If you've got a positive test already, you shouldn't be coming out of isolation until 10 days. If you have got symptoms of COVID and you're not a contact of a known case, and then you get a negative test, that proves, if it's a PCR test, that proves that you haven't got COVID, so you can come out of isolation. But if you're the important bit, and usually the area where there's a lot of confusion, is if you're a contact of a positive case, you have to self-isolate for 14 days. Even if you get a test result after 5 days that says that you're negative, you still have to isolate for 14 days, because the incubation period is potentially very long. It's potentially up to 2 weeks. It's usually 5 days, most cases within 10 days, but to be on the safe side, the limit is set at 14 days. So you can't come out of being in isolation as a contact with a negative test, I'm afraid.
Richard, just thank you for that, Duncan. Final question for Duncan, I think, is from John, which is what's going to happen about absent management when the vaccine's widely available? Will COVID absence be counted in the same way that flu absence is?
I don't really understand that one, I'm afraid. In terms of absence, do you mean absence from the school figures? I presume that means from the school figures.
John, do you want to give clarity on your question? Can you unmute?
Oh, staff absence.
Yeah, so if a member of staff refuses to have the vaccine when it's widely available and then is absent because they contract COVID, I mean, it's probably not a question for Duncan, really. This is more of an HR question, but it's something I'm quite concerned about, and I don't know whether other heads have got this as a bit of a worry.
I know what you're getting at. I'm not really sure what you can do because, we don't have any laws around vaccination in this country. You can't go to school in Australia if you don't get vaccinated, but it's parental choice in the UK. So, sort of applying those principles that if somebody comes to school and then there's a measles outbreak because they haven't had the MMR jab, you just have to sort of accept it really and put in all public health measures you can do. If a staff refuses to have the vaccine, that's their right to do that, I'm afraid, isn't it?
It is their right, but at the moment we cannot include absence from staff because on an absence management procedures and warnings and so on, if it's a COVID absence, and I'm just wondering if that's always going to be the case. So something like flu, if a member of staff doesn't have a vaccine for flu and then is absent with flu, we can count that absence in the normal staff absence management procedures. And I'm just wondering if as I say, it's an HR question more than a public health.
I don't know is the answer to that, I'm afraid, John. Sorry about that.
But certainly something that we can pick up in perhaps the breakout rooms, or we can put to our sort of colleagues in DFE or local authority and try and get some guidance on it. Thank you so much, Duncan. As always, really informative. And thank you so much for the great words that you said about the fantastic work that the heads are doing. So it's now with great pleasure I'm going to introduce Ruth Dennis, who's the head of educational psychology here in the Bradford sort of district. I'm sure most of you know Ruth already. So Ruth has been part of this fantastic team along with Christian and Alex, who you hear from in a wee while, trying to pull together this sort of support service for sort of staff. But Ruth's just going to talk through now just some of the sort of support that is available for sort of her schools from the educational psychology team. So can I hand over to you, Ruth, please?
Yep, remember to unmute, so that's always good. Hi, afternoon, everybody. So my name's Ruth Dennis. I think you know Mark introduced me. And my point today really coming here is to just try and help everybody sort of like make sure that they're aware of the full range of services that you can get from educational psychology. And I think because what tends to happen is that because we're involved in education, health and care assessments and children with special needs, we get a little bit badged as that's what educational psychologists do. But there's a lot more to our role than that. And so I'm just going to give you a quick rundown of the things that we are able to offer at the minute. And you're just going to have to wait. Oh, has Katie done it for me? Katie, have you put that up now? Yeah, marvelous. Save me having to fiddle around trying to do it. So, and just first point to make is that we are still working on business as usual. So the educational psychology team has been going into schools from as soon as schools were reopened, we are going in. So if you have got children and young people who you would normally refer to educational psychology, don't stop doing that, because we are still working. We're doing consultation work, we're doing in-school assessment work and other work. Clearly we have to, our sort of like our stance is, if there's an opportunity to do it remotely, then we will, because there's no point in us bringing germs into your school or vice versa. But if there's something that we actually need to do and be in school for, we will come in following your risk assessment and our risk assessment. The second thing that is new, and I really want to flag up to you, is this team that is linked to Duncan and the public health, is the educational emotional wellbeing practitioners. So this is a brand new team that are starting with us. They actually started last week, and so they're just on an induction this week. And this is a team of practitioners who are going to be available to support young people where they're struggling with their emotions or with their emotional well-being, but particularly due to issues around COVID. And so some of the things that we're finding are that perhaps there's young people who've been out of school for quite some time because of lockdown or shielding or whatever, and then they're finding that transition back into school really difficult. Sometimes there's people who maybe they've actually found it easier being in school when they were in school with a very small group of children and adults around them, and now that going back into that wider school is really quite hard for them. So these practitioners, there are 4 practitioners and a lead practitioner, and they sit within the educational psychology team, and they will be linking with the 4 different areas of the city: north, south, east and west. And they will be able to carry out short-term pieces of well-being work with children and young people. It says on there, details on Bradford Schools Online. I'm just about to put them on sort of hopefully tomorrow, because they did only come into post at the beginning of the week, and so it's very early days. But from January, we're hoping that you should be able to make a referral to that team to pick up, and they will, if you make a referral, what will happen is they will then talk through with you what your concerns are and decide with you if that's an appropriate referral and how to pick that up, and then they'll carry out this intervention, and there you go. So that's one to watch out for. The other thing is the mental health champions. So mental health champions, again, is a piece of work funded by public health, and Mental Health Champions has been going for quite a long time now, 3 or 4 years at least. But what we decided at the beginning of this year was that we really need to focus Mental Health Champions this year around emotional well-being in relation to COVID. And so the educational psychology team, through the Mental Health Champions, have been rolling out the DFE Wellbeing for Education Return training. I think everybody has had opportunity to come on that now. We've done the original rollout, we then did a catch-up rollout, and now the materials are available online as well if anybody's missed that. And so we're going to be asking the emotional wellbeing practitioners, just when they make contact with you, to say, hello, I'm here, we're around now. We're going to ask them to just check how you've got on with that training and whether there's anything you need to follow up from that. And so that will be almost like the follow-up for that. The other thing the Mental Health Champions are doing is that we're trying to make sure we keep on top of what are the key issues for children and young people in schools as we go through this year, because it's a bit of an unknown what issues are going to be most pertinent. So they're carrying out a really brief temperature check audit at the beginning of each of their meetings, so that's their half-termly meetings, to try and look at what are the key issues that are popping up in schools across the district, so that they can then focus down on what it is that they're going to provide for their training or support for the next half term. So that's some really important pieces of work that the Mental Health Champions are doing. Next one down is the strategic support for staff emotional wellbeing. This is a new piece of work that we're trying to set up now, probably linked to our work around critical incident. And if you think about, if you've ever had a situation where you've needed to involve the educational psychologist because you've had a critical incident in school, what we tend to do there is to work at an organizational level with the with the management team to look at how to support the whole school around that particular incident. And what we want to do is to try and extend that now to look at how can we support schools when there's a whole school issue around well-being. And so what we're doing is we're using our understanding of psychology, our understanding of system psychology and organizational psychology, on top of our understanding of how people respond to trauma. And what we want to be able to do is to provide support to managers within school, so whether that's the senior management team or whether it's the head teacher or whatever, so that we can support you if you're feeling that there are issues around staff wellbeing that you're just drawing a blank on and you're not really sure where to go on that. So what we're going to, so somebody said about costs. At the minute, there is no cost associated with this at the minute. It's coming through the funding that we already have, and through some of the COVID recovery funding. So the way we're going to do this is we're going to do a number of short seminars, webinars on emotional well-being at that strategic level. And if people have done that and then feel they still need some additional support, we will have some online consultations, sort of face-to-face, but obviously through WebEx or whatever. And we'll look then to support you to develop a plan for what you might be able to move forward on. Other things that I want to just talk about. So All Aboard, if anybody's known me over any length of time, All Aboard is our early years intervention program, which we use to support schools to look at catch up for young people in the early years. So reception, nursery age children, when they come into school and are coming in at quite a low level due to sort of situational circumstances. And so what we've realized is, actually, what's really good about that program is that it addresses all of the issues that Ofsted are picking up about young people and the difficulties they're finding when they're coming back into school and in the early years. And so we've had a bit of a rehash of All Aboard, and All Aboard is now going to be rolled out, but with a specific focus on catch up for children and young people who are in nursery and reception. So that's already on Skills for Bradford website. If you are interested in that, follow that up. And we're really lucky that Born in Bradford are going to evaluate this for us this year. And so hopefully at the end of the cycle of intervention, we'll have some really strong data that allows us to then roll that out even further, because I think the strength of the program in normal times is great, and I think it'll be even stronger under COVID. And I just can't see the last bit, Katie. I think it's right at the bottom, but there it goes. It's all right. I can see. I've seen what it says now. And just the last bit there is just as a heads up, really. All of these things that we're doing around emotional well-being is a really strong push to support schools to develop really strong offers around emotional well-being for children and for adults working there. And one of the things that we're trying to do is to pull all of this together into almost like a charter mark for an emotional well-being in education. This is it's in progress, but I think it'll probably launch around September. But all of these strands that we're looking at here that you can see on that slide are all going to pull together to hopefully culminate in this emotional well-being charter mark. So just watch out for that. It's on the way. And I think that's the end of everything I need to tell you at the minute. So I'm not sure if there's any questions, Mark.
Yeah, we've got a few questions for you, Ruth. Celine is asking, is the Educational Emotional Wellbeing Practitioner service available to independent schools?
Don't know the answer to that, but I can find out. So,
if you let Katie know, then she'll get an answer.
Yeah.
And then Christian's asking, what are the costs associated with this offer?
So of the Educational Emotional Wellbeing Practitioners.
It's not clear. Christian?
Yeah.
Costs associated with the full offer, really. I mean, the different tranches of it.
Yeah.
What's free and what isn't?
Yeah, so the Educational Emotional Wellbeing Practitioners, that is funded via COVID recovery, so that there's no cost associated with that. The offer around the webinars and the support to strategic leadership, at the minute, that's looking like we will be able to do that without cost. I suppose it depends somewhat on take up. If every last ounce of our time is taken doing that, we won't be doing anything else, and so we need to think about that. But at the minute, we can manage a small amount of capacity for that. The All Aboard training, there is a cost to that, but it's minuscule. It's something like 100 quid, or it's pennies. It's not anything major. And clearly our key offer, which is the one at the beginning, is a traded offer, but unless it's through statutory work.
Thanks, Ruth. I think that's it in terms of questions. So that's fantastic, Ruth. Thanks so much for that update. And I guess we're going to come back to this topic as well when we start hearing about Swoosh at 5:30. But what we are now going to do is have our normal slot, our popular slot, where we hear from some heads about their experiences over the last sort of period of time with regard to various issues. So I'm going to start with John and Lynette, who are going to be talking about the creative use of staff to support covering teacher absence in both primary and secondary schools. So if we can hand over to John and Lynette.
Which one of us would you like to go first, Mark? Shall I make a start?
As you wish, but given you're online now, Lynette, why don't we go with you?
I will. Obviously, I'm super keen. I jumped in there. Good evening, everybody. It's great to see so many people in the group again this week. It's proving to be very, very popular. So yeah, creative use of cover. And as I've thought about this, I'm not really sure our approach is creative. I'd probably say it's more sensible rather than creative. We've made the decision at the end of the year that we were going to really share the development of our teaching assistants across school. Our strength of teaching assistants was really in Key Stage 2, and we wanted to grow that across school. And that has, without us thinking about it, has been a massive support in terms of cover. We have really looked at who we've got, what skills we've got, who we've got in those classes, and who is best to cover them, and where possible, cover has happened within a bubble rather than it having people having to move around. And we felt that that's been great for the safety of our staff and our children. We've involved all of SLT in those discussions around how things can work. And we've really asked staff if they're comfortable with covering as well. I would never want a teaching assistant to cover if they couldn't or didn't want to. And luckily we've got a great team, like many of our schools, of staff who will cover classes. Where we haven't had cover, our assistant heads are non-class based. So we've been very lucky in, again, that they are keen and motivated and have jumped straight in there. I think we've all missed being in classrooms. So to get the opportunity to go in and teach, I think for well-being has been very important for our leaders and allowed them to refocus. We've looked at every case in its own merit, really, how long people are going to be off for, what the circumstances of the sickness are. We've had a couple of instances at Crossley Hall where it wasn't just a 14-day period of absence from school, and it's been a longer, slightly longer COVID recovery for staff. So we've had to bring that into the mix as well. We've also looked at things like modifying what's going on in the classroom. If it's something that couldn't be delivered as it usually would, then how would we modify that to make sure the children are still getting a good quality of education, but how we can make sure that what's delivered in the classroom, if it is a teaching assistant, how that's being delivered well in terms of supporting them. It's worked for us. Everybody's got their own approach in school. Everyone's got their own base of resources to use. Everybody is different. Crossley Hall is a 3-form entry primary school. We've spent under £1,000 on supply costs. So supply has been an absolute last resort there. You could argue bigger school, more staff to move around in that way, but we have had a lot of COVID in that school. We've had more than 30 cases, including children, but just under 30 for adults. At Grove House, it's slightly smaller, 2-form entry, but we've spent less than £2,000 on our supply costs in relation to COVID. So we were in a good position in that we had the quality of staff to cover in-house, and that has led us well really into this situation and how we've been able to strategically play things. But as I said at the beginning, I don't think it's a creative approach. I think it's been sensible and making decisions for your staff and your pupils that are safe, not only for their health but for their well-being as well. I will hand over to my secondary colleague.
I was just thinking there, I don't think this is a creative approach either, but if I give you a bit of a context, we very much have a sort of a team environment in school life, so that no staff are different. So our teaching staff and our non-teaching staff, we try and we treat the same. So our expectations to young people are exactly the same for that. So that's allowed us to do a variety of different sort of strategies to support this through this role. In terms of covering lessons, we do stuff like master classes where we join cohorts together and we add support staff in there who have been upskilled to work in those lessons, work with large groups of students and to support the teacher. And where that happens, we've had to take quite senior staff to deliver some of the cohort so that the students are getting a high quality education experience, as well as obviously the support member of staff's being supported in lessons. We've reduced numbers all around the building to take away a lot of the daily practices that are not necessarily having the impact. So we would try and release time for people throughout the course of the day. We use academic mentors, we use librarians to support activities to make sure the young person's experience can continue to roll. We've gone to our part-time staff to offer them extra hours if they want it. That's been quite popular. My lights have gone out here. So we've just tried to get. I suppose it's the team approach. We constantly survey staff to make sure that we're listening to their needs and their requirements. People that feel that they want to step up have shown us now that they've got some really good ability, and I've probably got a couple of members of staff who will be undergoing teacher training programs in September because they've stepped up outside their roles and they've seen another side of school life that they want to take part of. But yeah, it comes to sort of our whole school approach to life, that everyone's important and that we try and get everyone involved in every aspect of life. But behind that, they're well supported by their line managers, their senior leaders, making sure that they've got the skills to do the job. And our pastoral team then back that up. In secondary school, we patrol the school. I talk about patrolling it within an inch of its life. So it means that when we do have to have cover in, that anyone that comes into our school is well supported so that learning can continue to take place. And there's always consequences to actions for young people that don't disengage. And so it just means that when our cover teams are in dealing with stuff, they're very well supported. So I don't think it's particularly creative, but yeah, I mean, it's what we're doing, and it's we've managed to significantly reduce our costs down, which were, I think we hit about sort of £15,000-20,000 for the first half term, and it's been a significant reduction now. And one of sort of our key aspects to school life is we try and be kind to each other. Don't ask too much, and I have a massive expectation on TLR and leadership post holders to take away unnecessary tasks and activities, and that's had a big impact for us.
Excellent. Thanks so much, Lynette, and thanks so much, John. And just to clarify, when Lynette described John as secondary, she was, I hope, referring to the school rather than his attributes.
Absolutely. I wouldn't dare say anything else. Sorry, John.
Well, I've got very thick skin, so.
Excellent. So Duncan has in the chat put up that paper so that people can read that at their leisure and disseminate it amongst other people. So that's in the chat. So we're now going to hear from Sarah, who's going to be talking to us about school leadership over the weekend. We will be having an open forum for discussion later. We're well on track time-wise. We might have some opportunity for sort of questions for sort of John and Lynette after this, but we'll go through, hear from all the heads. We'll see if we've got time after this particular session to talk some of this stuff through. If not, there is that open forum for discussion. So if I hand over to Sarah now, though, who can talk to us about school leadership at the weekend.
Hi, everybody. I only found out from Christian earlier this afternoon that he wanted me to talk on this. So forgive me, because I've really focused on what we've been doing at Newby about how we're managing the weekends generally. And I'm not going to lie, it's been very stressful. I'd have like lockjaw for about the last 2 months. I don't think I've been grinding my teeth every night for about 2 months. Okay, so one of the things that I thought would be really useful to talk to you about is how we've had a very proactive approach to managing school life through the weekend in terms of a need to know only basis. So as an SLT here at Newby, we have our own WhatsApp group, which is called Staff Welfare. And as an SLT, we are the only ones who communicate to each other through the weekend. We're very mindful of all our staff having a break. We have a going home checklist, which we have on our door as we go out, as people leave, which basically says, take a moment to think about your day, acknowledge the most difficult thing at work today, and then let it go. And be proud of what you did at work today. Consider 3 things that went well. Check on your colleagues before you leave. Are they okay? And are you okay? Because your colleagues are here to listen and support you. Now switch your attention to home, rest and recharge. And that is our mantra. So I see us as leaders protecting that. So over the weekend, we don't email. We don't get in touch. If we need to do emails, we do a delivery delay that are coming on the Monday morning. But the main thing is through this COVID crisis, we only contact people when we have to. There is a need to know only and no knee-jerk reaction. So there was only been 2 occasions at Newby where I've had to effectively contact public health and DFE on a Saturday because we've had positive results. And on those stances, it's only the people I've needed to contact that have known about it. Because actually I can let parents know, but Monday is easily done. We can do it Monday morning. There's nothing that can't wait till then. And then we start our remote learning on the Tuesday, because we give ourselves a day to get all our equipment out, to make sure everything is there. And that's really important for us, that we all have a break. It's harder at leadership level, but you have to be aware. I give myself Saturday, and Saturday is my sacrosanct day when I don't do anything. Usually I sleep, followed by drinking, but that's a completely other thing. I won't go into that one. But that is really what we're doing over the weekend, and we're managing everything on a need-to-know basis. I hope that's helpful, and it's very much put together within about 5 minutes.
Well, it didn't show, Sarah. I thought it was super useful. So as I say, we'll take sort of questions or discussions about it, either in the open, the discussion sort of a forum, or after we've heard from some of our other heads. So I'm going to move now to John and ask him just to talk through the topic of safeguarding during lockdown and enforced isolation. So John, can I hand over to you, please?
Yep. Can you hear me now?
Yeah.
Hello. Right, safeguarding during lockdown and obviously all the bubbles that have been popping everywhere. Well, I mean, all I can do is talk from my own experience, but I am absolutely convinced that everybody here has been doing very, very similar. I think I mean, the thing is, you know, with this whole pandemic, we're all doing things, you know, unprecedented things, aren't we? But safeguarding is something that we all do very, very, very well, I think, isn't it? Obviously, one of the chief concerns at the start of the pandemic, when we were told schools were closing, you know, we only had a couple of days' notice. In fact, I was quite poorly when we got that message. When we were told schools were closing, was safeguarding, wasn't it? And everybody just suddenly thought, right, safeguarding, which kids are we worried about? So we're making lists, making sure that we can keep in contact with them all. And obviously, we were opening for the children of key workers, those with social worker, and the vulnerable children. So, as all schools, what we did in my 3 schools was we, you know, identified who were the most vulnerable. Some of them had social workers, some of them didn't. You know, some of the ones who we were probably most concerned about didn't actually have a named social worker, but we knew that we needed to get them in school, you know, and really keep an eye on them. So we were open for those children. Plus, of course, we were delivering vouchers everywhere, Asda, good old Asda, because Eden Red was an absolute, I know there was mixed experiences of Eden Red, but we didn't have a lot of success with it. So we were buying a lot of Asda vouchers, going around to people's houses, but it did give us the opportunity to visit these homes. You know, we did try and visit every home, delivering school reports where we weren't delivering vouchers and so on. We also had a named DSL member of staff who was doing phone calls because they were isolated. So they were calling people's homes every week, unless obviously we had a higher level of concern when it would be done more regularly than that. We are blessed to have a Catholic care worker who is a social worker who works 2 days with my schools as well. So she was a really, really big help. And obviously, as everyone else I'm sure we're recording everything on CPOMs. Now obviously since not Christmas, I don't know what day it is, it's December, isn't it? Since September, and bubbles have been popping all over the place. Similar kind of thing, weekly check-ins with those children we're concerned about delivering these houses. Obviously, with the video lessons via Google, it gives us an opportunity to see into some of these homes, and monitor. We also monitor who is engaging and who isn't engaging in any that we're concerned about. Then we're making those regular phone calls. But I think from safeguarding point of view, I mean, this whole year has been a bit crazy, but we don't feel in my schools that anybody has particularly slipped through the net that wouldn't have done. I know that won't be the case everywhere, and that there probably have been some awful things that have happened because of lockdown and isolation. But for us, it's been a fairly positive case. But I'm absolutely convinced that everybody on this call will have been doing very, very similar. And I dare say I wouldn't have done anything different from anybody else. In our schools, that's what we have to be brilliant at. We have to be brilliant at safeguarding, get that right, and then we worry about everything else. So I don't think it's I think it's quite a positive message in terms of safeguarding what we've done. We've been able to cope with it through all of this. Anyway, that's enough from me.
We like positivity, John. Thanks so much for that. That's really useful. So we're now going to go back to Sarah, who's going to be talking about supporting low income families. If I can remind everybody that there is the opportunity, just put any questions you have in the sort of chat. I can see that Ruth has made the NHS checklist are available, so please do use that. There's been a couple of questions to Sarah about the Going Home checklist and whether she created it and whether she could share it if she gets the chance. So I'm seeing lots of nodding from sort of Sarah there. As I say, Ruth has already put something in the sort of chat, so we'll take care of all that as we always do, either in the chat box or we'll do things sort of offline downstream. But Sarah, if I can go back to you now, and if you can tell us about supporting low income families.
Absolutely, I will. No problem about the checklist. I'm happy to share that with anybody who wants it. It was actually something that it was Bryn Llewellyn actually, who used to work in Bradford. He shared it on a Twitter page, I think, and I thought, I like that, and I just made it ours. No original ideas here, folks. All nicked. Anyway, low income families absolutely has been what I prepared, because that has hit our school and many, many schools across Bradford. There's been a massive growth in poverty in Bradford and Keighley, not affecting there, you, John. In a massive growth in free school meals as more and more of our parents have had to go on to benefits. A lot of the inner city schools in Bradford and Keighley have parents who have jobs that are in such industries as taxi drivers or piecework or work that is very much cash in hand, takeaways and that type of thing, and restaurants, and their income has just massively fallen. So during the lockdown and continuing, we've had more and more families who are literally destitute. And one of the things, as a BD5 community of schools, and I'm talking on behalf of my BD5 colleagues, and I know quite a few are on here tonight, we've very much had a conjoined view, along with community partners, to support our families in many, many areas. And that's been an absolute strength of our area, without a shadow of a doubt. Throughout lockdown, many of our schools set up food banks in school where food was donated by staff, and we had them in our halls and worked and fed our families. We knew we had 30 families we regularly fed. We've worked with wonderful community partners such as Shine in BD5 at St. Stephen's Church, who are true Christians, you know, absolutely true Christian, and other places like Mappa that have given out and gone round houses and food banks and just signposting people. We've developed extremely strong parental relationships throughout lockdown that have enabled us to have and build trusting relationships. That has led to an awful lot of parents being able to trust us enough to divulge on a one-to-one basis some really, really desperate situations. And just to give you a bit of an idea of what that's looked like, I have a particular parent who saw me recently and said that her husband had lost a job, her mum had got cancer, they were desperate. And I said, you know, can we give you food? Do you need clothes? Do you need, you know, what do you need? And she said, actually, I've set up a little business and I'm making food. And I just wonder if you've got anything coming up in school that I could cater for. And we did have a twilight. And so those are the sorts of things that we've done. We've invested when we need things, we're investing in our community in order to give people those opportunities. We've got a pupil and parent support worker in school at Nahida who is amazing, and she works one-to-one with families, and a lot of that has been about signposting, about benefit advice, about enabling parents to know where to go, and that's been really, really important. The other massive thing, and I may have said this before, and if I have, please forgive me, is the digital poverty. So in these times where the government gave us literally immediate remote learning, we've talked about that before, our parents don't have those digital devices. A lot of them don't speak English, they don't have Wi-Fi, they don't have that infrastructure, they don't have a quiet room. And one of the things we were absolutely passionate about at Newby was that every single child would have a digital device. So during lockdown 1, we gave out all our laptops. So every laptop we had, and we bought dongles and we got children online. We've now, since we've come back and through the remote learning, we literally have spent our carry forwards as a school, because that was a rainy day and this is the rainy day, and our family and our communities are the rainy day. So we've bought Chromebooks now for every single child in Key Stage 2. We were fortunate with getting, on the day the Getting to Help came from the government, and we got 45 iPads through that. So our children, when we get our budget again in March, we've just got a small number to get, and then every child will have a device. And we have dongles. And we have ways of saying to parents, don't you worry, we will teach you this, we will show you. And our parents feel supported. In addition to that, we've trained 13 of our staff as mental health first aiders, and that has enabled our mental health with our children and our staff, but also our parents, because we found a massive upsurge, and it comes with poverty, it comes with low income, and the stress and the strains, and an increase in domestic violence and safeguarding issues have definitely shown. So we see ourselves as a school at the absolute heart and hub of a community. Our children will never thrive if they're not loved and they're not fed. And it goes right back to that Maslow's hierarchy of need. And we as a school see ourselves, and as BD5 community, that we look after that integral element of children before we'll ever get them to be academically able. So that for us has been the absolute essence of our lockdown and COVID experience, supporting our families who then we can teach to support their children. And that's got to be a win-win situation. Thank you.
Absolutely amazing, Sarah. Inspirational work that you're doing, that I know everybody on this call is doing. I mean, just to repeat, you know, we've got the Bourne Bradford populations, we've been surveying them. The problems that the families and children are experiencing are just immense. And of course, it is the most disadvantaged part of our community who are bearing the real brunt of this terrible situation. But you are making a difference. And I think the question that we've got to be grappling with over 2021 is how do we support the schools to play this incredibly important role in looking after children's social emotional well-being, in dealing with issues such as food insecurity or the mental health epidemic. So you know, it's going to be our rallying call over 2021, but just to say that all of the data we're getting absolutely confirm what you're sort of saying, and showing just how powerful schools are within the system that's providing that frontline sort of support. So a massive thank you. So we'll, as I say, come back to any sort of questions or comments on this after we've heard from Rob, who's just going to be talking to us about working with families over the Christmas break. So Rob, can I hand over to you, please?
Yep, sure, thank you. That's a really tough one to follow, Sarah, because actually, you know, how could you possibly beat that amazing work that you've been doing? So, you know, and I think all schools have been doing just hugely amazing things over this whole period of time. So I signed up to say that I was going to work with families over the Christmas break. It was a tough selection this time because the ones I wanted are gone already. So I'm certainly not here talking and kind of holding up an example of something that I think is not really being replicated anywhere around school, really. So all I can do is talk about our own personal experiences and what we're kind of aiming to do. And I think the first thing to think about for us when we're thinking about supporting families over the Christmas break is how we also support our school staff as well, because I think first and foremost, staff at school need to be able to walk out. You know, they need that checklist that Sarah was talking about earlier to know that they can go and have a complete relax and recovery over the Christmas holidays. And I know this is not unique to our school at all, but for us, the previous half term, the October half term, was really quite challenging for a number of our school staff. It's when our numbers spiked weirdly on the Tuesday of the half term. So fingers crossed that doesn't happen again, because actually what I need more than anything is for staff to return in January, ready to fight the good fight and keep on going, really. So I see really that our main job over the course of this week really is to ensure that our families feel reassured and supported and, you know, ready to go into a Christmas holiday, to be able to kind of bed down, I suppose, really, and look to one another and know that when they come back in January, that this school is able to provide everything that we do on a weekly basis. So that's my main thing, really, is around providing reassurance for our families as they head off. And our families are really nervous at the moment. Our reception bubble have just come back today, and they've been off twice. So they've been off for a total of 4 weeks since October half term. And I know that some of those families are so nervous that that's going to happen again between now and next Thursday when we close. So it's kind of how we can just kind of support families through that. And really for us, it's about front-ending the nurture and the support ahead of the holidays. So I've got a fantastic pastoral team here. They're small, but they really are very dynamic and effective. And so again, my parental involvement worker and our assistant head for inclusion have been doing a lot of work over recent months. We've seen an increase in early help referrals and support that family need. So over the course of this next week, it's really going to be about kind of checking in with those families, making sure that they've got everything they need really to feel equipped to go into a period of absence away from school. And just feel that they've got everything they need. So that's our kind of main focus, really. And then as Duncan said earlier, you know, obviously we're aware that schools will need to be on call for that first 6 days after the holidays start. So we're kind of making sure we have a COVID email, again, not a unique thing. So that's going to be our main form of communication, and that's going to be put out to parents in tomorrow's blog to make sure that they know that if anyone does develop symptoms, they can get in touch with us via that COVID email over the period of that first 6 days of the Christmas holidays. I know that some schools are using Google Forms and other forms of communication, but that's going to be our main method, is through our COVID email address. And on each day, there's going to be a member of our senior leadership team who's going to be available to kind of field that. And then something that I'm really proud of, and again, this kind of is insignificant compared to what Sarah kind of has just talked about in what she's been doing, but we've, you know, I kind of really recognise that across Bradford, every school is different, and there's there's kind of really high levels of deprivation. Saltaire Primary isn't a school that's represented as having a high level of deprivation. However, there are families within our community that really do face financial difficulties, and that's been compounded by the current situation. So the one thing that kind of I really want to shout about in terms of what we've done in preparation for the Christmas holiday really is around the financial support and ways that we can support families going into what can be a really difficult period for Christmas. And we were approached by a group of parents who were really keen to do something for families who may be facing financial difficulty over the Christmas period. And that happened a couple of weeks ago. And over the course of the last few weeks, we put together a holiday fund, and that's been working in partnership with our parents. And inviting parents to contribute to that holiday fund. And we've actually raised through that just over £1,000, which is an amazing thing. And it's meant that we've been able to put together a package of support for families involving vouchers to be able to spend at the supermarket. Local greengrocers provided some fruit and veg that's going to be able to go out to those families as well. Local chocolate making companies provided some chocolates, and then the parents are going to go out and buy some gifts as well, which will be part of this hamper that we offer to parents over the holidays. And the thing I would say is, with the catchment that's representative of our school community, is the take up was very slow. And so one thing we had to do was kind of actively go out, call families, that we identified as being vulnerable, and make contact with them. And actually by putting out the hand of friendship to them, if you like, really, we've been able to kind of offer support to about 10% of our school population this Christmas, and they wouldn't necessarily have asked for that, so we've kind of really had to kind of put that out there. So that's something I'm really proud of. I think I'm really proud of our community for being able to offer that. And pleased that we've been able to support some of our families in that way. But for me, the most important thing is making sure my staff are rested and ready to come back to what's on offer in January, and that families know that we're going to be there to do that when they come back to hopefully a healthy, safe and nurturing environment. So that's it from me.
Wow, thanks, Robert. You're absolutely right to be proud of that, and we're proud of you. I mean, that is just phenomenal. And just the flag, actually, I mean, this work is being noticed. So we had a minister, Vicky Ford, Minister for Education yesterday, flagging up the brilliant work, or fantastic work, I think she said, that's happening in Bradford. So, this is sort of showing what can be sort of done when a bunch of like-minded people get together and really try and make the world a better place. So thanks so much for that, Robert. So we've got a few minutes for questions. There is a question for Duncan on here. There has been some sort of a chatter about Matt Hancock's announcement of widespread community testing, so much the levelling up agenda, because that's actually widespread in the southeastern London, apparently. But, I'm sure it'll come up to the north at some stage. Duncan, there is a question for you here, which is about the local authority contact centre being open until the 23rd. So the question is, if the school isn't closing until the 18th, they go straight to the DFE helpline instead?
I'm understanding the question as what do schools do after the 23rd? There's the DFE helpline that I haven't got the information on when the DFE helpline will be open. PHE will be open as well. So there's on-call PHE. What is the question? What do schools do after the 23rd of December? Because they've got the local authority contact number right up until then, and I don't think there'll be, probably after 2 or 3 days after closing school, there shouldn't be that many new cases anyway. If whoever asked the question can just clarify. Sorry if I'm not understanding it.
Claire, I think it was Claire. Claire, can you clarify your question?
Yeah, sure. Yeah, it was simply that. So if you're not closing until the Friday, that the LA, it says on the for the contact centre, it closed on the 23rd. So it was just, is it DFE? Would there be somebody there on the 24th? I know it's probably unlikely because it's, like you say, a decent amount of days on.
I don't know the DFE opening lines, and we're still trying to clarify the contact centre after the 23rd. So what I'll do is I'll find that out when the DFE is open. I don't know if you've checked online, Claire. It might be online already, but I'll try and clarify that and get the dates when DFE line will be open.
Yeah, thanks.
I mean, I think what we're increasingly finding is, if you look through all the reports that are coming back to us by the contact centre, the last question that they ask you is, do you want public health to phone you back? Probably out of 20 or 30 a day that we're getting, there's maybe only 1 or 2 now as well. So my message to you would be, if you've had COVID cases in the school before, and you'll have gone through that process of identifying contacts, phoning the parents up, giving them the advice, unless there's anything else that's more complicated than that, and it might be in terms of special schools, or you might want to clarify isolation periods and things like that, give us a ring by all means. But I don't think the DFE, I mean, some of you that will have phoned the DFE up, you know the sort of advice you get back. There's probably not a huge much more than that they can give you and help you with, actually. So if you're going to phone DFE up, think first, can we phone public health up and get the same advice? Because they'll give you the basic stuff that's in the guidance. And everything that DFE will tell you, we think we've put on Bradford Schools online now by that public health page.
Okay, thank you.
Thank you, Claire, for the question. Thank you, Duncan, for the answer. Great, and massive thank you to the heads for yet again their inspiration and their great insights. There will be the open forum for discussion where we can always pick up on some of these sort of items again. But now, really sort of are pleased to hand the floor over to Christian and Alex, who are going to be telling us about Swoosh, which is our school staff wellbeing support sort of our service. Huge amount of work has gone into this. Thanks so much to Alex and Christian and Ruth and the whole sort of our team. Really exciting, because it is the health services coming together with the education services, coming together with the local authority to really try and respond to a need. And massive thank you to the Department for Education through the opportunity area for supporting this initiative. Really a great example of, as I say, what is good about being in Bradford. So if I can hand over now to Alex and Christian, who are going to tell us about Swoosh.
Katie, would you share the PowerPoint that I've let you have, please? Okay, thank you, everyone. Just go back to the red screen, the first screen, please, Katie. Okay, so today, with a small blast of trumpets, we're announcing the launch of Swoosh, School Staff Wellbeing Support Service. I appreciate that that's more like swoosh, but we're calling it Swoosh, so you remember it. And we're announcing that that's live from today. This is a direct result of the feedback we've got from people on this webinar, from people who've come along right the way through this term and have talked openly about the challenges that they've been facing and the toll that it's been taking upon their school staff. And we've heard it in the room today. And so we've responded to that. Time and time again, we've talked to schools about various issues, and head teachers, school leaders keep saying, but what about my staff? What about them? In the middle of all this work that we're doing, who is looking out for them? And I know you are doing it yourselves as school leaders. You look after your staff first and foremost, and you look after your children too, the pupils in the school. And this speaks really powerfully about Team Bradford, about the work that we're doing together as a city to make a difference to the children and to the teachers during this really tricky time. This offer here recognize the extraordinary efforts you're making, but also the extraordinary impact it's having, that COVID is having upon schools in this city. So Swoosh will provide much help needed for all your staff, for your leaders, for you, your leaders, for teachers in your school, and for the majority of people employed by schools, which are members of the support team. It's always, I suppose it's always been really clear to me that we often ask many of our colleagues in school, our support staff, to do some of the most difficult work, and we pay them the least, but they end up picking up a lot of emotional impacts from that work. And so we want to reach out to everybody, a universal offer. This is going to help you as school leaders as well. And I think it's a real strength that we've heard from these meetings, a real strength that we've, and a real clear view we've got, is that you think it's important for you to speak up for yourselves and for the teaching profession. Like, you want to be there to help not just yourself, but other colleagues like yourselves, other people in senior leadership, your teachers, and the school staff that you've got all around this city. So we're launching today an offer which is a universal offer for the cohort of perhaps 220 head teachers, the cohort of perhaps 1,500 senior team colleagues across Bradford, the 5,500 teachers, and the something like 12,000 members of the support staff that work there. To launch this initiative, we've had to move really quickly. This was an idea that was raised back on the 8th of October and brought to you on the 12th of November. And now 5 weeks from there, we're launching that. So we've gone from an idea to sourcing the funding, putting the project team together and being able to launch today. Swoosh, the School Staff Wellbeing Support Service, is a collaborative effort brought to you by the National Health Service, CCG, including Healthy Minds, the local authority, schools, the Centre for Applied Educational Research, and such work that we can do at Bradford Birth to 19 to help to make this happen. This is the city working together in a common response to COVID in exceptional circumstances, and we've moved quickly to do something that was really needed in this city. Can I have the slide 2, please, Katie? So the key points from this, and again, people have heard some of this before, but I've got new colleagues on the call tonight. This is a support package. It is for head teachers, senior leaders, teachers and school staff. It is for all staff in the city who are working within the educational system. And it's providing practical support for school professionals operating in challenging times from today. And it's using the capacity that's already there, but we've sourced funding, support from the Bradford Opportunity Area, which is DFE, and the local authority working in partnership to provide an offer for you, which is quality, using colleagues who are already skilled in providing response to people when their emotional well-being is being put to test. And it's being released and being launched from now. But I heard Lynette talking about last time, it's a really powerful phrase. In a sense, this is the right thing to do now, but it's really kind of sad that we've had to have COVID to make us wake up to the emotional challenges that are being put on the school leaders and the teaching and the school workforce. It's sad that it's taken us COVID to work up to the fact that this is a really important issue. If we can just move on to slide 3, please, Katie. So there are three offers there, 3 key delivery pathways. The first one, which is one I'll talk about, which before I hand on to Alex, is the quick support, access to support for school leaders, an online document storage facility on Bradford schools and online to make sure that you've got the resources and the information and the current up-to-date guidance in one place, so that you're not needing to reach back through your emails to find the right thing and being worried whether or not you've got the most recent version. You know, there will be version control there. The only thing that will be on there are the most recent and up-to-date resources. A space for you to be able to share practice between yourselves as school leaders, and the opportunity to engage in and participate and lead and listen to peer-to-peer webinars, head teachers talking to other head teachers, just like the colleagues you've had today speaking with such passion and such expertise. A single place for you to access information and a peer-to-peer support message board. I will be able to look at that message board to extract key themes, key concerns that we can talk about in much more detail at these COVID webinars, which will be extended into next term and the summer term, another 8 webinars for the rest of this year. I'm going to hand over to Alex, and at the same time, I'm going to attach a file into the chat, which is the Swoosh offer. It is a draft flyer only in terms of the permissions and the watermarking on the images that we've got there. The offer the telephone numbers, and the access to the resources and the timeline, and the fact that it's live today is true, so that you can use the information that's within that document. I'm going to hand on over to Alex now.
Thanks, Christian. So yeah, I just want to talk about the second part of the offer, which is about yourselves, just thinking about yourselves and just offering yourself some self-care at the moment. I know Sarah mentioned earlier that on a Saturday she sleeps and, you know, might have a drink and things like that. And I just want to really stress here that we've got a really good offer here of an emotional well-being check for you to call in, for you to speak to somebody, and not just about work. It could be anything, could be personal, anything like that. And that you can have a confidential, safe space just to talk about what's going on for you and what working in a school environment and, you know, in this ever-changing pandemic environment is doing for you and your emotional well-being, you know, and just getting some support. You know, we've done this offer as well across the acute hospitals with our colleagues and our nurses who at times were coming out of shifts into the car park and just breaking down. They couldn't deal with going home to family. There was so much issues going on, and, you know, they found this service really, really helpful. And we want to offer you some therapeutic support, some counselling support, some mental health support for you, and just to help you deal with it. You know, that there is an incredible amount of stress on everybody to deal with the staff teams and be the leaders that you need to be. But, you know, it must be very, very difficult, and we want to help with this. It's an offer there. It's open. If you call the number, you can book in a wellbeing check, and then you can be signposted on to more counselling. There's 6 up to 12 sessions sometimes if you need it at a time that suits you. We will also be setting up a phone line where you can call in if you don't feel, you know, that there's anything wrong, but maybe, you know, we spoke to some teachers and they said Sunday evening's a trigger sometimes where we think, wow, we're going to have to go back to a full working week now, and that could be a trigger. You know, there's a phone service there available to you to speak to somebody, as well as the immediate kind of therapeutic support. We're also setting up a training platform which will allow you and all your staff in the school to access training around self-care, sleep, anxiety, and this training, again, it's for you. It's for the individual taking it, and this can be done on an e-learning portal. We will also be looking at themes. You know, we've put some training together here, but we recognise that as months go on, things may emerge, themes may happen, and we will be responsive to your needs if you need additional support or training. There will be an additional element to this of what Ruth was talking about earlier, so the educational psychology element. So it's a really good offer of support, and, you know, I really feel for what you're going through at the moment and what you're dealing with. We're all dealing with issues, but especially head teachers, senior leaders, teachers, it must be very, very hard. So please take up this, and, you know, I hope it's okay for you, and feedback to us on if you need anything different. You know, we'll try help.
That's great, thanks.
Can you just push the PowerPoint through to the last slide there? Okay, so just before I hand back to you, Mark, I said this was not this was without permissions obtained for the photographs. They've now been obtained just whilst I've been speaking to you. So the document I put in the chat, SSWSS Swoosh Final, is actually there and ready to go. So that's available now. So very clearly, looking at that pathway to support today, head teachers and senior leaders are able to access a welfare check. You can look at the document there. That's ready to go now. So if you are yourselves or colleagues you know within your wider senior teams, or other colleagues not represented here tonight, would like to take advantage of that, it's ready to go now. And the offer there of support for all school staff is ready to go now. The peer-to-peer messaging app and the stuff on BSO, you'll have to wait a little bit of time for. And the training offer, you'll need to wait a little bit of time for. But the phone lines, the access to therapeutic and counselling support and somebody to talk to is ready to go from now. Mark.
Amazing. Well, I'm wearing my hat. Amazing, Christian. Amazing, Alex. Thank you so much. So we've got a good period of time, actually. We've got 16 minutes until the sort of sessions are over. So please do feedback anything that you think could be improved or anything you'd like us to sort of tackle with this. But if I can also open the floor now, and if people would like to discuss whatever they want to discuss, either about this particular project or about what we've heard from the heads. It really is an opportunity now for an open forum. So any questions at all or any comments, just put them in the chat there. If I can just open up the floor, or if people just want to jump in, please feel free to do that as well. So Christian's just sort of put in that you're very free to circulate the Swoosh offer as widely as you like. We really hope that this is going to make a sort of a difference to sort of schools and heads throughout the sort of region. So please do promote it and let people know that this resource is available.
Lynette, will you still be our Twitter champion for our hashtag? And Sarah.
We're getting lots of love there. So we've got our social media captain there, Lynette, who will be promoting it on these newfangled devices that these young people use. So thanks so much for that, Lynette. Nick's just put a comment in that this is really excellent and so quickly put together. Well done. I mean, I've never seen a project go from sort of a zero to a completed package so quickly before. Just a fantastic testimony to everybody's brilliant sort of work across the whole sort of system. So Lynette is telling us to look out for it on Twitter. She's getting her tweet on. I don't have Twitter, but I'll take your word for it, Lynette. Sarah's sort of saying the BPIP area heads are going to circulate through BPIP. Nick's asking, what's your Twitter, Lynette? I think, Nick, you'll find it's what's your Twitter handle, actually, is the appropriate terminology. So, Lynette, maybe if you can put that in the chat, that would be brilliant. Has anybody got any questions for the heads or for Duncan or for anybody on this call or team?
Could I just make a particular request, really? You know, we've had remarkable attendance here this evening, and everybody will get copies of everything that's at, come online at any point this evening. But with particular regard to head teacher and senior leader, mental health and well-being, can I ask you to distribute this and to use your contacts and I suppose your judgment, really. My worry is not about the people in the room here this evening, it's about the people who are not here at all. And it's sometimes those people who are perhaps most at risk, feel most isolated, who do not know which way to turn, who don't come along to events like this, and I think it's, I'm suggesting that it's behoving on all of us to do what we can to get the message out as widely as we possibly can. I will reach out to the Catholic Schools Network. We'll do a double dose on BPIP area head teachers. I'll reach out to the Major Academy Trust, to the Special School Network, and to the groups of special schools. If people end up getting the offer and the message 10 times, then it's only a good thing.
I think it is only a good thing, because I think the most important thing we want to sort of send out there is a strong signal that everybody cares, everybody recognises the amazing work that's happening in schools within sort of Bradford, and sends out that very, very clear message. You're not alone. We massively appreciate what you're doing. Duncan said it so well. We don't want our heads and our deputy heads to sort of, escape to the hills, although we understand why you want to escape the sort of hills. But we need you. You are making this amazing difference to people's lives. We are here to support you. So if this helps, then that's just sort of brilliant. I see that Jackie's got her hand up. So Jackie, do you have a question or a comment to the group?
Oh, yes. Hi, I'm Jackie. I'm from Newby Primary, Chair of Governors. I just wondered, I'm really impressed by this scheme, and I'm sure there'll be a lot of demand, and I wonder how you'll prioritise. Will it be first come, first served? Because I can imagine everybody putting in applications as soon as they get off this.
Well, that's fine. We've got to, it's well resourced, and if that becomes an issue, we'll sort of deal with it. But we've worked out, we've done our back of the envelope calculations, and I think we're sort of comfortable. Do not let capacity be an issue. That's our problem, not yours. I think Christian's perhaps going to say something about that.
Okay, so insofar as that, if we look at numbers, it's a really important question. The three kind of like pathways, online document storage and all that kind of stuff to do with the BSO, unlimited capacity, but it's a head teacher thing, so all people can access that. the wider training offer, which is for all staff. It's an online training platform. It's all staff within the Bradford school system, okay? And we've got sufficient resources, largely because it's unlimited in terms of the ability to be able to access that. In terms of the welfare check and the therapeutic offer, insofar as that we've got, it's 6 sessions for a particular colleague. It may be 1, it may be more, but if it is 6, we've got initial capacity to reach out to 100 colleagues, but let it become our problem. And if it is our problem, then we'll seek additional resources to be able to, do what we can to resource that. But initially, it's 100. I have made colleagues aware of it already in particular circumstances, so I do believe it's going to be popular.
And also, just to add that when we set up the peer messaging board, that you will be able to attend the webinars, the peer support webinars, and we may from time to time bring professionals in to facilitate some group sessions on specific issues. So there'll be about like a timetable of that, and we're really hoping that you can log in every week, and just get some support, give some support to each other and get additional support yourselves.
And to be clear, right, the principle here is if you're not well supported, if you're not in a good place, how are your teachers going to be in a good place? And if your teachers aren't in a good sort of place, how on earth are we going to look after the social emotional needs of children and young sort of people? And that's the end game, right? There's nothing else that sort of matters right now more than looking after the needs of the children, young sort of people. So we've got to make this a success. If we hit capacity, then we will campaign. We've got fantastic allies. So Sasha Batts, head of commissioning for the CCG, people care. People across the system care. I think we're so fragmented, we forget that. But this webinar series is a testament to the fact that our clinical colleagues here in the sort of hospital, throughout the whole of the sort of health sort of system, really, really recognise and value the work that's happening in sort of our schools in the same way that you recognise and value the work that they're sort of are doing. So let's if it turns out that actually the need is far greater than this can provide, then it's our job to go and put this on a regional and national sort of radar and deal with it, because it's the only chance that we have to give the next generation the best sort of possible start in life. And that's surely the moral responsibility for us all. So yeah, please don't worry about capacity. That's our problem, not yours. Use this sort of better system. And if there is this overwhelming demand, then we will find one way to meet that demand. Sorry, Alex.
Just to add one more thing as well, we'll be sending out a more detailed flyer with the pathway, because I have just been notified by Ruth that we didn't add her pathway, the 4th educational psychology pathway, onto our presentation. So I do apologise about that. So we will do a proper, more detailed flyer for you in early January. But this is just to let you know that you can access the psychological therapies straight away.
Okay, I'm going to put my hands up. That's my fault. I became so obsessed with the front page, I didn't really look what was on the sort of second sort of page. We had huge sort of debates about the sort of images on the front side. So apologies for that. It's very much a work in progress. Actually, it fits quite nicely with a comment that Adam's made, which is he's having problems downloading that leaflet anyway. So can we email it? So we'll email an updated version. And apologies if there are a few sort of tweaks, in the meantime. But we will get an updated version as soon as we can and get that out to everybody, and we will email it. We'll email it widely, and then please do disseminate it. Lynette's put her Twitter handle in the chat. It's at PAYExecHead. So please do use that. And Lynette says that we're going to keep it simple, like and share the post. And Twitter apparently will work magic for Bradford. Wonderful.
What's the hashtag, Lynette?
Oh, sorry.
What's the hashtag? Swoosh. Yes. Okay.
Yeah. Okay. Hashtag SSWSS swoosh. So hashtag SSWSS is what you need to retweet it. Christians are flagging up that the next webinar is on the 14th of January. So we can check how everything's going at that stage, make any refinements. Nothing here is set in stone. This is all about us working together to get the best possible service we can to take care of this critically important sort of issue. Lynette's just preparing the first sort of a tweet. So it's hashtag swoosh. Hashtag you are not alone, hashtag in this together. Apologies for any political slogans that we've acquired on the way, but they're great. Thanks, Lynette. Any other questions or comments that people want to make?
Someone's just asked me, do you have a poster like that for the NHS, please? From Nick. What did you mean by that, Nick? The same. Do you want me to email you the poster?
To be clear, there's a similar service for the NHS, so it's the listening service up here, and so the team that were responsible for putting that together provided us with all the information that we use. That's one of the reasons why we could get something up and running for the school so quickly. So to be clear, there is an NHS sort of service been really successful, and we've learned from that, and that's why we really wanted this sort of offer for this sort of a school system. Yeah. Any other questions? No, I think we're coming to an end then. So thank you so much again for all of the brilliant presentations this evening. Thank you so much to everybody who's made this webinar series possible. Huge call out to Katie and Catherine, the Opportunity Area team. Thank you so much to our clinical colleagues. Duncan has just been doing an amazing sort of job. I mean, we're so fortunate in Bradford to have this incredible public health sort of a team. Thank you to Dinesh and John and Helen and Anil, all our pediatrics sort of a team, everybody within the sort of our hospital system for supporting this. But mostly, thank you to everybody who's participating in this, giving their sort of a time. It just gives that community feel, and it is just this incredible community of sort of our practitioners. So I'm just going to wish everybody, a really happy sort of a Christmas. Boy, do you deserve a Christmas sort of a break. We got hard times ahead. Dinesh made it clear, so much optimism on the horizon, but we're not out of this yet. So we've got to keep working together, keep supporting each other so that we can really turn the tide. And let's also use this as the opportunity. A spotlight has been shone on all kinds of issues, such as where is the support for the social emotional well-being of heads and the school system. So let's keep that spotlight shone on these issues, take the opportunities to really make substantial changes. So let's make 2021 a good one. But before then, have a fantastic break and really looking forward to seeing everybody in the new year. A quick message from Joanne, which is many NHS trusts do comms through their staff banks about well-being. So absolutely. So we feel we've got it quite well sorted on the NHS, but now's the time to do it within the school system, and that's what Swoosh is all about. So get tweeting, get disseminating, have a brilliant Christmas break, and thank you so much to everybody for giving up their sort of time. Goodbye. Thank you.
Thank you.
Thank you.